Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we're going to do literally a super rapid A to Z of brachioplasty. You know, most of our episodes have guests, which I love, but sometimes with the guests, we don't get to the nuts and bolts of things. So I'm going to go ahead and do a sort of A to Z of brachioplasty for you, and then we'll have yet another episode where I'll have a patient and they can talk to you about, and I think we've done them before, regarding their recovery and things of that nature. So let's just dive right in. A brachioplasty, what the heck is that? A brachioplasty is a surgery in which we remove redundant or excess skin of the arms. So why would you be removing excess skin of your arms? Because you have excess skin. How did you get excess skin? And almost always it's because I lost weight. If you lose a bunch of weight, which nowadays is quite common, whether that's bariatric surgery, diet and exercise, or semaglutides, Ozempic, Wegovy, Mounjaro, what have you, often the areas of your body that have been stretched out don't bounce back exactly they were before you gained weight. And one common area, or one area that people really dislike and complain about, is sort of bat wings, or the excess skin and looseness underneath their arms. So it drives people batty, no pun intended. And as a result, there's a lot of self-consciousness around people's arms. For people with normal arms, they know what you're talking about. For people who hate their arms, they know exactly what I'm talking about. And you will know who they are because it'll be 90 degrees outside and they're wearing a long sleeve shirt. And I know hundreds of patients who have come to me, and almost every person who ended up getting a brachioplasty was wearing full sleeves at all times, at the beach, at the pool, at all times. No tank tops, etc. So you can only imagine how it impacts the quality of life. So the question is, so now I've lost this weight and I have this excess skin, if you will, hanging from my arms. What are my options? Well, people think that they can go, and they do get a lot of it, just go and get liposuction, because invariably there's going to be skin with some fat. I would caution you to go and get liposuction of anywhere of your body, no less your arms, where it's already loose. Once it's gone in that direction and you go in and remove whatever residual fat is there, you can be 100% guaranteed it will be looser. It will look worse. So liposuction and some type of tightening, which we've spoken about hundreds of times, is a nonsensical approach. The issue at hand is redundant skin, just like on your belly, just like in your neck, just like in your breast, and it needs to be excised and cut out. So when it comes to bat wings or excess skin, the answer in the treatment is to excise it through a brachioplasty. The next question is, okay, we'll find, but where are the scars? Or how are you going to take it out? There are only two ways to do them: short and long scar. 99.9% of patients want the short scar, and 99.9% of patients need the long scar. So let me explain. The short scar is basically putting a short incision in your armpit from which you're pulling the excess skin. Now, unfortunately, that doesn't do squat. The only time that's a useful surgery is when you're an older patient with a little bit of crepey skin near and towards your armpit, and you can just cut that out with a small ellipse. But 99% of my patients have a lot of redundancy, and the only way to excise it is along the latitude, the entire longitudinal aspect of the arm. So in other words, the long scar from your elbow to your armpit is what's necessary. The next question is, where do you hide it? So there are two places you can put that scar, and I prefer one. You can put it on the inner arm, or you can put it on the back of the arm. The reason why I prefer and I choose to do it on the inner arm is so that when you're standing there, watching and talking to people, and you're at the beach, as long as your arms are just by your sides and you're doing things, your scars are completely invisible. In other words, no one sees them from the front, no one sees them from the side, and no one sees them from behind. Of course, our goal, and we'll get to this part, is for the scars to become very well concealed and no one sees them, period, but certainly we want them on the inner part of your arm. Okay, so that takes care of technique. When we do it, it's both skin and fat together. We're not just removing skin, but we're removing the skin and fat as a totality, and we're making your arms smaller and tighter, and therefore you can see the anatomy of your muscles. Okay, let's talk about recovery. This sounds really miserable. Well, it's not really that painful, but of course, anything that involves your arms or your legs is going to suck, right? You are incapacitated to a certain degree, and you need your arms. And of course, you can't use your arms the same way you were before because the incisions will come apart. So In terms of recovery, the pain is minimal. However, it is kind of a little bit of an annoying procedure. You're going to probably need to be off of work for about 10 days to 14 days. So let's just say 2 weeks. And you're going to need to not be exercising tennis and basketball and whatnot for 6 weeks. And then after that, you can kind of resume your entire normal life. I like patients to wrap their arms to keep things compressed. But once you kind of get out of the gates and you're out the 6 weeks mark, you're pretty much back to normal and you can go live your life unbeknownst to anybody else. All right, so let's talk about the risks with this procedure. So the risks are as follows. Bleeding and infection, that's standard, very minimal. If done correctly, bleeding and infection should be almost none. Asymmetry, very big issue, is that one arm is bigger than the other or one arm is smaller than the other. Now, we all know that everyone starts out asymmetric, your eyes, your ears, your brows, etc. But there are surgeons who are not that accurate. And when you're not that accurate, you may leave the patient worse than they were before, and that asymmetry is significantly more obvious. When I so-called mark the patients, I use a laser pointer. Why? Because I'm psycho and I'm a real nitpicky guy. So I like to be very accurate in terms of my measurements, but definitely asymmetry is quite a concern. The next is contour irregularities. So what we notice about the arm, it has a shape, right? It has a shape, just like the forearm has a shape. And it's not uncommon that surgeons will remove too much skin from one area, not enough from another, and you get like a sort of like a tube-like look, or one area is narrower than the other area. So just removing skin isn't going to cut it. You need to remove skin in a way that it makes the arm, the residual arm, look natural, like a real arm. And you want to make sure that your arm is bigger than your forearm, right? Like, you don't want to be Popeye. You don't want your forearm bigger than your arm. So it's not just as simple as removing excess skin, but rather how you design the skin to be removed. And by far, the last issue is scars. And that is always a concern, but like through the roof concern when it comes to things like brachioplasties or thigh lifts, because unlike a breast or an abdomen that can be hidden, you get a breast lift, it's horrible. You get a tummy tuck, it's horrible. You hide them. You go to the beach. You get a horrific arm scar, it's visible forever. So let's talk about that. The skin of your inner arms is kind of shitty, thin skin. It's not the best quality skin. It's not like the skin of your abdomen or your breast often. It's very crepey. Therefore, when surgeons close it, they kind of just close it not so clean. Therefore, when the scar heals, it doesn't heal so well. And then patients are told that they keloid or they just don't make good scars. And then they laser and this and that. At the end, it's just a mediocre scar. When I close the arms, I am super compulsive, which I am all the time, but I close layer by layer by layer. And that allows it to distribute the tension so the arm isn't under too much tension. And the skin is closed with a tiny 6/0 nylon suture, which then I need to remove. In my humble opinion, it leads to significantly better scars, which then leads to significantly better looking outcome, which then allows you to be more free, right? The goal of a brachioplasty is for you to wear a tank top. Go to the beach. Just be free. And if you have exchanged bat wings for an ugly, hideous scar, you're not really free, are you? Now you just have another thing you're concerned about. So you got to pay attention, and those scars don't heal as well as other areas because remember, aside from the closure, you're moving them constantly. You're using your arm, so that is under great tension. The last thing, and I'm just going to dabble on it, is most people who need a brachioplasty do so because they lost a lot of weight. And when they've lost a lot of weight, they have a lot of loose skin everywhere. And one of the areas they have a lot of loose skin is on the thorax, on the outer side of their chest. And not only just their trunk, but their upper trunk as well. And there's a technique that I was involved in terms of its development. This is going now back 25 years ago, in which we take the arm scar, the scar of the brachioplasty, extend it through the armpit and down through the side of the chest down to the abdomen. So just imagine in your mind, you're wearing a jacket, I'm wearing one now, and I follow the seam along my arm into my armpit and down the side of my jacket. Why that? And that secondary procedure is called an L-tap. And you can go Google it and you won't find it. It's called L-tap, meaning it's an acronym for L, meaning lateral. Lateral is outer. Tap, T-A-P, means thoraco. Thoraco meaning chest. abdominoplasty. Thoraco being chest, abdomen being abdomen, plasty being removal. So what we're doing is we're taking the scarf from your arm, going through your armpit where there's a lot of laxity, down through the side of your chest where there's a lot of laxity, and down through your abdomen where there's a lot of laxity. So this is a very unique addition to a brachioplasty. You certainly don't need it, but for some people who have lost, let's say, 70, 80, 90, 100 pounds, they'll find that once their arm is tight, they're gonna really hate the next transition area on their body. At any rate, I hope that was helpful. I guarantee you we'll have another episode with a patient, because the patient journeys have their own unique element. But as far as the sort of 411 or the skinny on brachioplasties, you now have them. As always, do us a favor, write something nice, go write a review. If you like the show, it helps everybody stay motivated. And then lastly, share our show. Share our show with your friends, because you never know who's gonna go get a brachioplasty. And if you're gonna send it to them after they had it, well, it's too late. All right, guys, well, that's a wrap. So that's yet another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rahban, and I will see you next week.